The topic for today's discussion is about the paracetamol overdose, paracetamol toxicity, paracetamol poisoning, hepatotoxicity, and due to paracetamol use and management or treatment. We'll discuss all these points with you guys in this video, in this particular video. So let's start our discussion from the very first point. That is paracetamol. When we just take this paracetamol, what happens to this in the body? It is supposed to be metabolized mainly in the liver. So in the liver, where it is metabolized, it actually provides two components, or it is actually metabolized into two parts. Number one is supposed to be non-toxic, and number one, toxic metabolite. The toxic one is known as NAPK, N-acetyl paraquinine amine. Now this one is supposed to damage your liver. How this damage is actually seen? Very simple. When you take normal dose, in the liver there is sulfahydryl available to fight the normal dose of the paracetamol, or one can say to fight with the NAPK. What will happen? This sulfahydryl will combine with the NAPK, and this NAPK will then become non-toxic, and this non-toxic NAPK is then supposed to be excreted from the body. Got? What happens if you increase the dose? So what will happen? Liver was having a certain store for thiols, means there was certain store available of the thiol, there was certain number of the thiol available, but now because of the abnormal dose that you are taking, this thiol store will become a kind empty. So what will happen then? Simple. Then the NAPK will be available to damage your liver. How? Like, just concentrate. Here we go with the example of paracetamol. If I take one paracetamol, this one paracetamol will produce 5 NAPK in the body. This is the way how it is producing, okay, the metabolism. Now these 5 NAPK, they will interact with the 10 thiol in the liver. What will happen? Here is a combination of 5 and 10. 5 minus 10, what is the answer? At the end we'll get 5. Don't confuse yourself, don't write minus 5 here. I'm just telling you the number, the difference, okay? So if the 5 is here, 10 is here, so 5 will fight together, and what will we get? We will get at the end 10 sulfahydryl available, and NAPK will not be available. NAPK will not be available. Why? Because the 5 NAPK have been they have been made non-toxic by the liver with the help of the sulfahydryl group. What happens if you take the same paracetamol in the increased dose? Okay, you are just actually changing a dose of this. I'm giving you an example, okay? So this increased dose, suppose this increased dose of the paracetamol, they will produce 30 NAPK. Now, normally stored sulfahydryl available in the body is how much? Is actually, a number is, here I have mentioned 10, okay, there are 10 sulfahydryl available. So we have got 30 NAPK because of the abnormal dose of the paracetamol, or because of the increase in dose of the paracetamol. So now this 30 NAPK will fight with the 10 sulfahydryl. 10 to 10 sulfahydryl will be finished now. So now there is no sulfahydryl available, remaining is 20 NAPK. Now these 20 NAPK, they are enough to damage your liver. Why? Because NAPK is toxic. Now 10 of the NAPKs have been made non-toxic, and they have been excreted from the body, but still there is 20 NAPK available. Now this 20 NAPK is responsible to damage your liver. So this is how, when you increase the dose of particular medication that is damaging your liver. So always take care of your medication while you're using. Consult your healthcare professionals, like primary healthcare professional is your registered pharmacist, then MBBS physicians or MDs. Consult them. Remember, regarding medicine point of view, you are supposed to consult time and again these doctors of pharmacy. So this is your priority, this is your first and foremost important thing that you are supposed to do, is consulting the medicine experts each and every time, before the prescription and after the prescription being assigned to you. Simple. For your primary healthcare problem, you must visit your pharmacist, and he or she, the pharmacist, will tell you to go to the specific physician for your proper problem. If it is primary, he or she will treat you. Otherwise, this particular pharmacist will send you or will refer to you to specific physicians, and those physicians will then they will write prescription for you, and that prescription is supposed to be brought back towards this pharmacist, and this pharmacist will go through the prescription whether there is a kind of error available or whether there is a kind of uncertainty available in sense of duplication of therapy. Means you are supposed to be given one paracetamol and by one name, and the prescription, he or she, the physician, whoever he is or she is, that is written for you, 2 or 3, means that is duplication therapy is there. Duplication, by duplication we mean that there is a kind of 1, 2, 3, 3 or 4 same things are given by different names to you. 3 or 4 or 2 or 3 same things are given to you by different names. Suppose we have panadol, paracetamol. It has got 2. One is panadol, one is calpol. Now this physician has written for you both panadol and calpol. When you bring this prescription to the pharmacist, he will or she will go through the prescription, and when he or she observes duplication, so then he or she will tell you, please wait for me, I will call the physician and I will confirm this from him, what is this. And there are certain cases, simple. In short, I'm telling you guys, there is a kind of communication should be available regarding treatment point of view. So your priority must be regarding primary health care. You must visit to the pharmacist. Pharmacist will refer you to the physician, and then come back to the pharmacist for getting the proper dose or proper information regarding your prescription. So like this, what will happen? Your disease will become okay rather than becoming worse or severe type. So this is how you must go through the treatment and the use of the medication. Well, this is the pathway that how your simple, the safest drug is damaging you when you are using this improperly. The point remaining is regarding management and treatment point of view. Well, this according to this portion, we have got two portions. Number 1, that is charcoal, and number 2 is N-acetylcysteine. We use these two in the management of the paracetamol toxicity. So these are actually used with respect to the patient's time, means how long has it been when the patient has used the particular medicine. So according to the time of toxicity, these two are actually then divided into priority. The priority is then given according to or with respect to the patient and with respect to the patient condition. Means time is supposed to be consulted, supposed to be kept in mind. According to time, then with respect to time, there must be a kind of option available, means what to choose then. Means we choose according to the patient time these two antidotes to treat the paracetamol toxicity. I hope you got the concept. If still you have confusion anywhere, feel free to ask us in the comment box, and thank you for watching.